The surge in COVID-19 cases has the health unit struggling to perform contact tracing. They're now considering having those with COVID call their own close contacts. There's 8 long-term care and retirement homes in Outbreak right now. One of them, the Village at St. Clair, is grappling with more cases than any other facility in the region. Tonight, we hear from staff about how it's being handled. -7 outside as we take a live look at downtown Windsor. You can see the streets already emptying. Chance of flurries tomorrow morning. Colette Kennedy has all of the details in her forecast tonight. I'm Chris Hensing. Thanks for watching. We begin tonight with breaking news. Hospitals across Ontario have been ordered to brace for a spike in COVID-19 patients. CBC News obtained a memo from the province telling hospitals to prepare to activate emergency plans, clearing up to 15% of their beds. It's from the CEO of Ontario Health, that's Matt Anderson. He says the pandemic's entered a more critical phase with widespread community transmission and that the ability to care for patients with and without COVID-19 is being challenged. The memo tells all hospitals to be ready to activate their surge capacity plans within 48 hours. Under those plans, hospitals located in lockdown and red zones, they need to make 10 to 15% of their beds available for COVID-19 patients. That covers us here in Windsor-Essex, all of the GTA, plus Hamilton, Waterloo, and London. Windsor Regional Hospital says it is already working to free up bed for this purpose. They currently have 36 patients with COVID-19 in hospital. Hospitals in the rest of the province are told to prepare in case their public health unit becomes a red zone. The health unit today is reporting 136 new cases of COVID-19. That's the 5th day in the past week that we've seen a triple-digit daily case count. It's leading to major challenges for health officials as it comes to contacting the people who are close contacts of positive patients. With more, I'm joined live by the CBC Sanjay Maru. Sanjay, what are health officials saying about that challenge?
Well, Chris, the health unit's saying today it may soon ask people who test positive for COVID-19 to essentially do their own form of contact tracing. Chris, this is really for 2 reasons. One being that major spike that we've seen in new daily cases here in Windsor-Essex. But the second reason the health unit says today is really about catching up to the amount of calls that they need to make to those people who have tested positive. They say there's about 500 outstanding calls that still need to be made, but because there's so many cases in the backlog, it's making it hard to catch up to those calls. Now, normally, the health unit would be tasked with reaching out to close contacts of a confirmed case. Now, they're essentially asking those who have tested positive for COVID to reach out to contacts on their own. And I spoke to Dr. Isaac Bogosh today. He's an infectious disease doctor and a member of Ontario's COVID-19 Vaccine Distribution Task Force. And he says that change could have, quote, detrimental ramifications to slowing the spread here in Windsor-Essex.
It's certainly better than nothing, but of course, in a perfect world, we'd see rapid contact tracing and thorough contact tracing and supporting people through a period of isolation if they really needed to have it. And that would be ideal, but clearly we're not dealing with ideal circumstances here. And because of the burden of this infection in many communities, including in Windsor-Essex, we're starting to see some cracks in the system emerge.
And just yesterday, the health unit saying it's in initial discussions with an outside agency to get some assistance with contact tracing, but Bogosh adding ultimately any and all help is needed to ensure all contacts are traced properly.
Now, when it comes to that extra help, I understand you reached out to the province today. What are officials of the 4 governments saying about this?
Well, Ontario Premier Doug Ford saying that he's been in constant contact with Windsor Mayor Drew Dilkens about this, and Ontario's Health Minister Christine Elliott adding that there may be new contact managers that will be hired by the province and brought here to this region.
We would be happy to assist them with extra contact managers, as well as some of the other regions that may not have high case counts are also supporting some of those other regions. I know we have some people in the north that are supporting Peel. I'm sure that they would be helpful with respect to what's going on in Windsor-Essex as well.
And you may remember earlier this month, the province brought in about 24 contact tracing managers to this region, but this consideration by the health unit, seemingly a move that would suggest that perhaps more contact tracers, more workers are needed. And the health unit also saying the goal behind this is to ensure that the focus is on newer cases for containment of the virus, and that high-risk cases from long-term care and retirement homes, schools, and all cases associated with other outbreaks would be prioritized as well. Chris.
Thanks for this, Sanjay. The CBC Sunday Maru live tonight. There's a huge outbreak at a Windsor long-term care home. The village at St. Clair is reporting more than 70 cases among residents and staff. Workers, advocates, they say that staff is not getting what they need to properly and safely care for people in the home and stay safe while this virus rips through that facility. They also say that more workers are needed. Jacob Barker with more.
It's heartbreaking knowing these people are going through this holiday season, and they probably feel very forgotten.
A staff member at the village of St. Clair speaking about what she sees inside these walls. A glimpse inside one can also get on its Facebook page, showing videos and pictures of events leading up to the holidays. But while these pictures have been showing up online, the health unit first reported the home to be an outbreak on December 8th. Schlegel Villages, which owns the home, says it's been in a massive round of testing for both staff and residents. Over the weekend, the facility says the virus spread quickly over the course of 24 hours. The health unit says it's looking into the outbreak, but it's too soon to say how it began. Numbers, according to a post on the home's website, says among its 256 residents, 48 have tested positive for COVID-19. 25 staff members have also tested positive.
We're short-staffed beyond belief. My managers are coming in to work every possible shift that isn't covered. These people are suffering, and they're going to continue to suffer. And there's only so much we can do, and there's only so much fighting we can do.
Yesterday, we heard from staff that some workers were being denied N95 masks, even those that are working directly with COVID patients.
Forced to fight for your own personal protection against spreading a disease that could very easily take out so many of these vulnerable people that we are, sworn to protect.
Right now, I think it's a disaster, and I'm very worried for my mother, and this is why I'm here, to make sure she gets some lunch.
Ann Doobie has long raised concerns about the home her mother entered in 2016, advocating for a minimum of 4 hours per care per patient.
From day one, I was shocked at the number of staff. They provided 3 PSWs and 1 nurse to look after 33 residents.
This weekend, she says staffing was particularly an issue.
I can assure you that there are not enough staff in this home today to look after the residents. And in my opinion, chaos and pity are the 2 words that describe the situation inside.
Jacob Barker joins us now live. You broke the story last night, but what's happened today at the long-term care facility?
Well, Chris, late this afternoon, we heard a statement given to us by Tammy Roberts, GM at the Village of St. Clair. They actually updated those numbers that I just said there. There are 55 residents that they say have tested positive for COVID-19, and that comes along with 34 team members. They're also testing positive. Those team members are at home isolating. It did say they do have a plan for outbreak management, which includes testing all team members and testing symptomatic residents. They say staff have never been without proper PPE, including proper surgical masks, gowns, gloves, and face shields, and N95 masks for use in any aerolized medical procedure. They also received a large shipment of universal fit N95 masks today, which are being provided to the staff, in addition to the N95 masks that were already in the home. And they did also provide this quote to us. They said that while having 34 staff members at home isolating is never something that they want, they are bringing in additional support to fill those spaces until staff can return to work, and are continuing to meet the care needs of the residents. The establishment of a field hospital is ultimately up to the hospital and public health authorities, and they support any and all decisions that their healthcare partners are making to respond to COVID outbreaks. Chris.
Thanks for this, Jacob. The CBC's Jacob Barker live tonight. Prime Minister Justin Trudeau says Canada is on track to get 168,000 Moderna vaccine doses before the end of December, once it's approved here.
The Moderna vaccine does not need some of the extra special handling requirements of the one from Pfizer, including ultra-cold freezers. And that makes it a better option to ship over long distances to more remote areas. So doses of this vaccine will be directed to the north, as well as to remote and Indigenous communities.
Moderna vaccines need to be stored at -20 degrees, which is possible in most commercial-grade refrigerators. Remote and rural communities lack the infrastructure to safely store the Pfizer-BioNTech vaccine at temperatures of 70 degrees below zero. A final decision from Health Canada is expected on the Moderna vaccine this week. The Prime Minister says that they will begin shipping them within 48 hours of approval. A little holiday cheer was spread by local businesses at the downtown Mission.
You either get a jacket or you get a set of boots. What would you like? Jacket. What size?
10 businesses donated over $60,000 worth of goods to 300 people who lined up outside the missions. The items included coats, granola bars, gift cards, and toques. You can see that also there was some social distancing taking place, masks as well during all of this. Rock solid windows and doors started the idea, brought in other local businesses as they went. One of the recipients said life would be tough without this kind of donation.
Struggling, you know what I mean? So it makes me all the more grateful, thankful, you know? A huge, big thank you. You made my Christmas.
Just always wanted to help them and kind of give back. You see more often that people are always saying, don't be afraid to ask for help, you know, whether you can't afford to buy groceries or if it's mental illness, don't be afraid to ask for help. Yet you have these individuals literally sitting on the side of the road with their hand out.
The businesses also donated $3,500 to the mission for extra needs. The clock is ticking toward a deadline for the downtown mission to get permission to build a new shelter. Back in October, it announced that it wants to build a new shelter, but it needs approval from the city first. It needs to come before January 31st as the deal to sell the current mission on Victoria Avenue closes.
The city put in the interim control bylaw a few months ago, right? That stops us from doing anything really. And then on top of that, we had to go through a zoning amendment and some other things. It's a very expensive and a very long process, much longer than I anticipated and much more expensive than I anticipated.
Okay, how are you, sir?
I'm hoping that the money that we're spending will be fruitful and will end in a positive decision, but I don't know that till the vote comes in.
Dunn adds that fundraising for the new shelter can't start until it gets approval. He says there are several verbal commitments, but needs solid pledges before it can get a loan to start construction. The first phase will cost $7.3 million. It's day 2 of the lockdown in Windsor-Essex. We heard last night from businesses about the tough days that lie ahead. The Regional Chamber of Commerce says that this month's sales could make up to 20% of a small or medium business's revenue. Lockdown measures are going to bring that down, but they were already dealing with a big loss when the border closed. My year-end chat with the Chamber of Commerce President and CEO Rakesh Naidu. When the border closed between the United States and Canada, what did it mean for businesses in Windsor-Essex?
For us in a border region, we rely on cross-border movement of people, of course, trade, visitors, consumers, tourists, and a lot of our business in the region rely on that and had taken it for granted, right? I mean, we were experiencing growth even in that, more American visitors coming, more American tourists, with a dollar being, much lower than the American. Many businesses were benefiting from that. So now that the border's been closed for the last 9 months, many of our businesses are very challenged because one estimation is that roughly about 25% of their revenue used to come from the American consumers, visitors, and tourists. So, look, in any year, when you have that kind of a revenue loss, it is a significant hit.
That 25%, what does it mean to those smaller than medium-sized businesses?
The 25% revenue is gone. Then on top of that, there is the additional cost of doing business, which is because of, the new health and safety guidelines, which, is necessary. There is no denying that. But then it comes at a cost, whether it is, maintaining social distance, whether it is, the use of PPEs, hand sanitizers, more cleaning, less number of businesses, less number of consumers that the business can serve. All of that adds to the cost of doing business. And then as it is, the pandemic has reduced the overall volume of business. The number of hours that businesses open, that has the effective number of hours that has come down, because you need to take breaks and clean up the facility, and you can have only as much you can do within the work hours, business hours. So there is that cost of doing business has increased. Revenue has gone down. Now we're staring at a lockdown, and then on top of it we have the border closed down, right? So if you put all of that together, it's a perfect storm for our businesses to be in, and more so in the border region because of the border closure.
As we try and weather that perfect storm, we've heard from the federal government, the provincial government, that they want to help small businesses, these employers in our community. What have you seen them do, and what else could they do?
Look, whether it is the federal government, the provincial government, the local government, local municipalities, they're all doing their best. And I think we should congratulate them. It's not easy to maneuver in this very rough times, and they're doing their best. There are many programs that are being offered. There's also one where, now businesses can get rent relief, through the commercial rent relief program. But then the government realized that the uptake was so low that they needed to change things. So they made some changes, which has been very much welcome. And they increased it to, they made it possible for businesses to tap up to 65%. And then in some cases, they've said that for those businesses that are hardest hit, you can claim up to 90%. Now, the definition of that hardest hit is that those businesses that are facing lockdown or have been asked to shut down because of health and, health unit, or where they cannot really remain open anymore, those businesses can claim up to 90%. And that, I think, is where we think the federal government needs to look into border communities and recognize that the border closure is a lockdown. We've lost 25% of revenue because of that. It's been locked down for the last 9 months. Prime Minister mentioned that it'll be closed for a long time. We don't know till when. So when you have an economic lockdown, which has the same impact as a health-related lockdown, I think our businesses, it's very fair for our businesses to be able to tap that additional, rent relief and be eligible for the 90% rent relief.
When do you start thinking about how are we going to pay for all of this?
I think that is something that we worry about every day, just because, it is going to cost all of us. There's no denying the fact, and there's no escaping that fact. It is just a question of when and how. As much as, the support is needed at this time, I think it is equally important for us to be prudent and to ensure that we find a way to recover fast. But there are ways to do it. But more important right now is for us to really focus on people, on people's health, ensuring that we get through this phase, getting the vaccines in place, and then planning a recovery.
We'll have more of that interview on our website as well. Let's take a live look here. Shine Bright YQG, a flash mob with candlelight outside of St. Clair Village of Aspen Retirement Home, where they're dealing with almost 90 cases of COVID-19. About 150 luminary lanterns are in front to show support to the frontline staff and patients battling COVID-19. The group is trying to spread light in what feels like some of the darkest days our community has ever faced. The iconic beach strip along Australia's Gold Coast has recently been anything but. Still, the bad weather's turned up a different reason for some to take to the water. Let's take a look at that there. A mix of wild winds, heavy rains off the Queensland coast helped whip up thick sea foam that you're looking at there. A rare but naturally occurring event. The region's been dealing with 5 days of stormy weather, and that's expected to ease off by tomorrow. But if you're wondering, it's summer there, above 24 degrees beyond zero. So a little different than what we're dealing with here, Colette Kennedy, as we bring you in. When you see the sea foam there, you're just like, oh, okay, well, maybe we might get some weather events here. We might get something to play with. Just a little snow in the forecast, please. That's all I'm asking for.
Yeah, those kids can't build snowmen with that stuff.
That's true.
So
That's true.
As really fun as that looks, I guess we have something on them. We've got the cold air element. We are going to see a little bit of snow. I think it's going to be a bit on the light side, though, in terms of accumulations for building those snowmen. But we at least have the chance with this kind of cold air in place. -5 is our temperature. Chatham-Kent, -3. Let's factor those winds in. And those are only going to be getting stronger over the next 24 to 36 hours. So we'll be seeing some pretty significant air in place that you're really going to need to bundle up for. This is the forecast wind gust, so north to northeasterly, but watch as they turn towards the east and start to really pick up. We'll be seeing gusts of 40, perhaps 50 kilometers an hour at times as we go through the day on Wednesday. And then we've got a system that's going to push towards the south of us. As it starts to slip away, it turns the winds more towards the northeast, and they'll back off the further it gets away from us. But it's kind of what's ramping up our winds. Now, in terms of what we have to deal with tonight, no active weather, but I do want to talk to you about what's going to be happening with this particular system and the tracking of it. We get into that easterly flow that I mentioned. Okay, that's one thing. A little bit of flurry activity tonight towards tomorrow morning, off and on, but as it tracks, it's going to just kind of clip by here across Lake Erie and along the northern shore. Yes, we will be seeing, this is towards tomorrow night, but even into the afternoon, we could start to see some light snow developing into the evening, and then it'll move away as we get towards Thursday morning. But watching as that comes through, some light accumulations before it peels away. Now, Thursday, I'm still leaving quite a bit of cloud cover in there, and then we'll bring back more sun as we get into Friday. Now, accumulations looking like this. I've seen a few models wanting to give a little bit more, and I mean 1 or 2 centimeters more towards Windsor, Chatham-Kent, closer to the shore. Even Leamington, you could pick up a few more centimeters there just because of how this is tracking through. -3 tonight, at least the temperature coming up a little bit as we go towards tomorrow morning. And just have a look, though. We've got a few days before we're going to be seeing those temps up there around 3-4 degrees.
All right, thanks, Colette.
You're welcome.
One of the largest class action settlements in Canada could be putting money in your pocket. That's next. Fashion retailer Peter Nygaard made an appearance in a Winnipeg courtroom. He was taken into custody last night following a request from authorities in the United States. They want him extradited from Canada to face charges that include sex trafficking and racketeering. The charges allege the 79-year-old Nygaard committed crimes against dozens of victims in Canada, the U.S., and the Bahamas, including minor-aged girls. Nygaard has denied allegations of wrongdoings in past civil actions. If you bought computer software between 1998 and 2010, you may be eligible to make a claim in one of Canada's largest class action settlements.
If you bought Microsoft PC software between 1998 and 2010,
This ad here is soon going to be coming to a TV or radio station near you. It's designed to get your attention about a national class action settlement with Microsoft. More than $400 million have been set aside. The lawsuit alleges that Microsoft used anti-competitive tactics to charge higher prices for some of its products. Microsoft denies any wrongdoing and has not admitted liability. Individuals can claim as much as $250 without receipts. That's it for CBC Windsor News. A reminder, you can find more on these stories online, cbc.ca/Windsor. Thanks for watching. Have a good night.